Hi, my name is Mark Bertin. I'm a developmental pediatrician, and I'm excited to be here at the ADHD Awareness Expo. I've been asked to start by just reminding you there'll be an online exhibit hall you can catch, and I'll just let you know that for the next few minutes I'll be talking about the topic, the three foundations of ADHD care, which is a model that I use often to really do one of two things to help myself when I'm trying to get a sense of a big situation or trying to help things feel more manageable. And I think parents can use it too, or adults with ADHD, to both approach challenging situations and also almost to periodically come back to and reassure yourself you're doing everything you can when it comes to managing ADHD. So just as a starter to introduce myself, I'm a developmental pediatrician. I've written several books, including Mindful Parenting for ADHD and the new book, How Children Thrive, which uses the concept of executive function, which is a developmental path having to do with self-management skills, as a way of showing in typical development how we can kind of understand the foundations and set our children up in ways that often let us let go of a lot of the stuff that's causing us stress and pressure in everyday life. And the reason I say that a little bit is because that directly relates to my topic today. So in introducing this concept of the three foundations of ADHD care, what I'd like to touch base on really before we start is just a general view of ADHD for just a moment. I think it's important to understand ADHD developmentally, conceptually, because it really helps explain an awful lot of what we need to do to help children thrive. And then, like a lot of developmental concerns, when issues persist into adulthood, really the same concepts hold. So when it comes to ADHD, I think the most practical way of viewing it, it's a reframing of it for many of us, is seeing it as a delay in a much broader skill set than attention called executive function. And executive function really represents all of our life management skills. So anything we can put management to in day-to-day life is potentially affected by executive function and potentially affected by ADHD. So we have to manage our attention, which means ADHD isn't always about a short attention span. It can be about hyperfocus in some situations, overfocus, difficulty transitioning attention, as well as a short attention span. We have to manage our behavior, we have to manage tasks, we have to manage emotions, we have to manage our health, we have to manage conversations. All of these things require executive function, which is the part of the brain responsible for attention and behavior and organization and planning and time management, a much bigger skill set than only attention. And the reason that's the first step to even laying out these three foundations of ADHD care is that a real shorthand for helping somebody who has ADHD in any situation, or helping yourself if you're an adult with ADHD, is just looking at it as a skill set that's behind. You're the most incredible, pick any skill. You're the most incredible athlete, you're really creative, you have all these wonderful skills in life, and ADHD gets in the way of self-management. So how can we support those skills in any situation? So what are the three foundations then, in kind of looking at putting those supports into place, in particular in childhood? The first one, the first place we can look at implementing supports is obviously in the school setting. And that's actually a legal right. So children have the right, if they have the medical diagnosis of ADHD, for supports in the educational setting, which are often way broader than the ones that are being implemented. The way to look at it is, if you have a child who's delayed in these self-management skills, anything we can relate to ADHD, we can put a support in place for that. So that means forgetfulness, to hand things in, dealing with routines, project management, taking tests. For all of these things, I could break them into dozens of different potential supports. But in starting a new school year, the way you want to think about it is anything we can relate to ADHD potentially can go into that school plan. And I think one of the most profound ones, one of the most challenging ones sometimes in working with some schools, is the recognition that self-advocacy and what appears to be poor motivation both are directly related to executive function. So that really, until children show their own capacity to manage school, to make a plan, to sustain a plan, to stick with goals, it's really best most of the time for the supports to be adult initiated. it isn't that they're necessarily going to keep learning from trial and error, or they would have learned it years ago sometimes. The real thing we want to do is we want to put an adult, moderated program in place that covers all of ADHD, and then gradually pull those supports back as children show themselves capable of taking the reins. So one foundation of ADHD care is making sure that the school plan is in place that needs to support a child who has ADHD. The second thing we want to look at are outside of school, family-based supports. And those are pretty broad, but it's an important thing to consider, especially if things aren't going as you want them to be. So what are these sort of outside supports that help with ADHD? They can be things like working with a cognitive behavioral therapist or an ADHD coach. One very important thing to recognize developmentally that's really, really challenging, it's no small thing, is that a lot of supports need to be implemented kind of through parents. Because if you're the one with ADHD, ADHD is a planning disorder. So children with ADHD learn from the structure parents create and build executive function skills through those routines. And then, as I mentioned around school, the goal is to gradually withdraw those supports as children show themselves capable. And that can be almost counterintuitive. It's amazing to see sometimes that children don't inherently understand the value of studying, particularly if they have ADHD, and the way to show them the value of studying, or even how to study, because that's an executive function based task too, is that we have to lay out what studying looks like, support that studying over a long stretch of time, and then through that experience, children learn the value of it. But if we just try to talk them into it or push them from the outside, since they don't have the executive function based skills to problem solve how to study that well, many of them will continue to struggle. They won't know exactly what to do. It may look like poor motivation, but often it's just an inability at that point in time to manage time so well, to study so well. Other areas of intervention in the family setting that can be supportive include obviously anything that can support parents. When kids have ADHD, their parents are often very stressed, very overwhelmed, which makes it harder to do all these things that you're being asked to do around ADHD. So taking care of yourself as a parent is quite valuable. And then there's a long list of more specific interventions that hopefully get taken care of at school, but obviously we can supplement around tutoring, speech language therapy, a whole list of things. So again, the purpose of this shorter talk is just to lay out a way of thinking about things. I'm not going to go into all of those details, but you can pause every once in a while and look at, okay, outside of school, do we have the full support in place that is most effective at this moment? Is there something that we need to change or adjust? So that's the second foundation of care. I often actually call this the 4 foundations of ADHD care. So there's one other piece to it that I think can fit into that model, or really can almost be thought of separately, whatever works naturally for you. Because another really important part of ADHD care is that ADHD impacts itself through just health routines. And that's very unique, so that ADHD kind of chases its own tail. So one other thing to look at outside of the school setting is that ADHD gets in the way of sleep, but if we can problem solve sleep problems, better sleep often improves mood and ADHD symptoms. Exercise, screen time can be very disruptive for many people with ADHD. Meditation can help, mindfulness can help. All of these things, to me, fit under an umbrella of health. And I think when we're looking again at the big picture of ADHD, if we just want to reassure ourselves everything's covered, we're doing a nice job here, or if we have concerns, like things don't seem like they're going as well as they could, that health piece can be a big one to adjust as well. And then obviously, for anyone familiar with ADHD, the third foundation to consider is really looking at the role of medications in ADHD care. And it's not something everyone wants to talk about, and I think it's a good model of medicine to always avoid using medicine. Anywhere in life you can avoid using medicine for any medical condition. If you can manage it non-medically, obviously that's always going to be better. And yet it's important to recognize in ADHD care that the use of medication is an evidence-based practice. However they're talked about online, they're really they're not as they're not as negative as they're presented. In fact, it's quite the opposite. The research says that most people with ADHD, if they try medication and if they really persist through the initial trial and error that's required to get ADHD medications to work well, which I think is often the problem. It's a very hard stretch. It can be very emotionally demanding. But that most people, 80% or more probably, of people with ADHD, if they work through that trial and error, can find a medication that gives them some substantial benefit with no significant side effects. And that's the goal to me whenever I'm prescribing ADHD medications, is no significant side effects at all, which can take a lot of work, with some significant benefit. The medications aren't a replacement for a lot of the educational things we need to do with ADHD. There is a lot of executive function that needs to be taught directly that we can't expect the medications to help with, around studying, around time management, around bedtime. These are more behavioral interventions or educational interventions. But for anybody with ADHD who feels like things have stalled or aren't going as well as possible, in spite of how they're often presented, it's important to recognize that medications have been around a really long time. As far as we know, they're actually, if they're used appropriately, quite safe, and the goal is no side effects. And thankfully, since they're through your system so quickly, it's actually fairly hard to cause persistent side effects with the ADHD medications, because if you stop them, anything that's causing a problem is going to go away. So the third piece, I think, to consider when you're trying to feel like you're on solid ground with ADHD, or to, again, just get a handle on, wow, there's so much going on here, it feels so overwhelming, there's going to be so many different things you're reading about and seeing online, and people are telling you this, that, and the other thing. It can be valuable sometimes, I think, to just pause and really just organize your thoughts into these, sections of care, these foundations of care. So just to wrap up for a minute, to just pause and reassess, like, is the school plan working as well as it could? Do we have the right supports at home and in the family that are going to help us manage ADHD? Do we want to consider medications? And if we are using them, are they working as well as they could? And do we have no side effects that are bothering us going on? And then somewhere in there, like I said, there's different ways I've given this talk over time, either as part of the family-based supports or as their own thing to think about. What about ADHD and health? Do we need to work on that sort of sleep, exercise, nutrition part of life in order to make things come together? So I hope that model can be useful for people living with ADHD, working as providers in the field of ADHD. Again, for anyone who wants more information on any of that, you can find me at www.developmentaldoctor.com. I greatly appreciate your taking the time to watch this video, and I hope to see some of you in person sometime soon. So thanks so much for listening, and take care. Goodbye.